Morning, Elias. How you doing?
To abo yedwene won na so bebe dwene ho aho bebe dwene ho so kra ye mom ye nya problem otine.
Hello. Hi, good morning. How you doing? You okay?
Yeah, good morning. I'll be on behind the scene.
Sorry?
I'll be on behind the scene.
All right, okay. That's fine. No worries. So
right,
just maybe if you're on the phone or otherwise, just maybe keep it muted, and when you want to ask questions,
I'll come back for it. Yeah.
No worries.
Okay, then, thank you.
Okay, thank you.
Bye.
Hi, good morning, everyone, and thanks for joining in this session today. So we are looking at continuing our journey on the unit, which is health and safety in health and social care. A bit of a mouthful with the health and safety in terms of health being repeated. But yeah, unit 4.25, in which, we covered yesterday some of the important bits of legislation, some acts and other compliance related, policies, which mostly all, let's say, all players in the health and social care sector have to follow. So when I say players, I mean by that care homes, I mean the National Health Service, I also mean centers or organizations which are involved in delivering care either in the community or under public-private partnerships. And this is where the main idea was to try and understand what are the various legal requirements which have to be implemented from a point of view of health and safety, for any organization when they are providing services or delivering integrated care, within the sector. So we covered learning outcome 1 yesterday, which had 3 assessment criteria. Excuse me. Yeah, and then today we are going to be looking at understanding, how we can look at, implementing some of these policies from a point of view of, understanding how these can be implemented within the sector. And when we look at delivering care, specifically from a point of view of delivering care to patients, or as a social worker, as a care worker, delivering care to patients. And essentially, when they are in a particular location, when I say location, what I mean by that is either a care home or a hospital, GP surgery, pharmacy, whatever they are, there are certain risks which need to be assessed to ensure that a care plan which has been put forward, works for them, and there are no untoward hazards or risks which the patient or the person receiving the care is prone to, or is, let's say, is going to face. And that gives the confidence to the person to be able to say that, okay, yes, the care that they're going to receive, or the procedure or the operative procedure that they're undergoing, is going to be a success, and that gives them confidence to be able to take that forward. So from our point of view, in the second learning outcome, we are going to be understanding how some of these risk assessments, which are coming out of the policies and procedures that we have studied in learning outcome 1, are going to be put into practice. And why are these very important in the process of ensuring that if a social worker or if a health and social care worker, nurse, anybody who's working within the sector, doctor, GP, pharmacists, people in the community, if they are associated with delivering care, how do they create an integrated plan, or if I may say a word, care plan, and that care plan essentially then ensures that the delivery of the care which is going to be, or the service which is going to be delivered to the patient in this case, or the person who's receiving the care, is confident that yes, all risks have been identified, all hazards have been either mitigated or can have been encountered, and there are plans in place to make sure that nothing goes wrong, and this gives the patient or the person receiving the treatment confidence that they are going to be receiving the right quality of care for which they have come in to seek that operation or that operative procedure. And this learning outcome has 4 assessment criteria. So we're going to be looking at understanding what is information that we can gather to look at assessing risk from a point of view of organizational policies and procedures. In the second one, assessment criteria, we will look at what is the impact of these policies when they are not implemented, or when they are implemented as per what is required to be done, and how standards are maintained, and how it affects the care which the customers receive or the patients receive. In the third one, we will be looking at dilemmas which can be encountered while implementing some of these policies, specifically related to health and safety. So here we are going to be discussing 1 or 2 cases to look at things like data protection issues. Sometimes when you are poised with providing information, and this has to be shared, but you are also looking at person-centered approach and making sure that the information being shared is not compromising the quality of care which the patient is receiving. So we look at some of those dilemmas which are related to the third assessment criteria when these policies and procedures are followed. And then we'll be looking at, in the last one, how does this affect the care plan, or essentially the patient care, the care which patient is receiving when these policies and procedures are not implemented as per the guidance set by CQC or some of the compliance bodies within this sector. So this is, I would say, again, a theoretical outcome wherein we are primarily looking at understanding the ways in which health and safety requirements can impact the delivery of care to a customer or a patient in a particular setup. In terms of the indicative content, this has been broken down into 4. So we are going to be understanding the concept of risk assessment first, which will lead us nicely into risk assessment and care planning, and then talk about the impacts of risk assessment and how policies and procedures can affect the integrated delivery of care which is being given to the patient. And towards the end, we'll go in and understand what are the dilemmas you can face, or I can face, as a social care worker, or as a person working within the health and social care sector, as a health and social care professional. Sometimes when you're tasked with information to be shared, or news to be shared, or in some cases some policies and procedures, when you implement them thoroughly, how can they pose you dilemmas in terms of or create issues, or probably, let's say, when I say dilemmas, what I mean by that is create doubts and issues in terms of you trying to deliver the care to the patient as per a plan. But some of these, implementation sometimes of these policies and procedures can create obstacles, hurdles, issues, or doubts. And we'll be looking at a few with some examples to understand them in a bit more detail, and how to mitigate them from a point of view of following the policies, but at the same time delivering and providing the information without doing any compromise, or be in breach of any particular policy which is being implemented within the organization. Now, as always, we will start off with some key terminology. Key terminology focuses on picking out some of the key bits of words from the learning outcome, and also sets the foundation for us to get into understanding and reading this particular outcome and the assessment criteria. So the first one that we have come across in this particular learning outcome is talking about risk assessment. Now, we looked at, I don't know if most of you recall, in terms of the meaning of the word risk that we looked at yesterday, it means that, you're involving in a situation which can expose you to danger. That is the literal book dictionary meaning of the word risk. And when we talk about assessment, what we are basically looking at doing is we are looking at understanding what could be, the actions that we would need to take in order to avoid those risks or situations that are going to put us in danger. Now, if we look at risk assessment as a whole, what we are basically discussing here is that we are going to be looking at a process through which we are going to identify risks and hazards which can appear in a workplace and can cause obstacles, can cause injuries, or can dissuade people from following systems, processes, in order to deliver their service on a day-to-day basis. And a risk assessment typically is an important part, because in the creation of a care plan for a patient, generally risk assessment is done on various aspects of that care plan. And we will discuss that in a bit more detail, but just very briefly here, the concept of risk tends to be identifying risk and hazards which can lead to injury or slippages, which can eventually cause, life-threatening injuries or maybe life-changing injuries to a patient when a patient is actually receiving care or is receiving some sort of treatment within, a particular setup, hospital, care home, whatever it is. Now, risk assessments that we typically do, start off with a very basic thing, and a lot of us can quickly relate this to the fact that when you go into an office or a workplace, you're generally asked to sign at the reception saying that you have signed into the register, have you driven down, who are you coming to meet, your name and your credentials. And the reason why that is done is also related to looking at some parts of it being a risk assessed, that because you are in that building, and you are under the jurisdiction of the employer or the organization that you're visiting. And if something is to happen in the event of fire, for example, if we have the act of God, maybe an earthquake or things like that, and if the fire brigade and fire ambulance services have to come in and identify everybody, then that visitor's book or the record register basically acts as a first point of contact to see how many people were in the building at the point of time of the incident. And this is also, a key point, just as a very, very simple example that is used to do risk assessment. Now, that creates a record. It also helps to identify, obviously, number of people in that building if anything is to happen. And, when you sign out, it shows that you have left the building securely, and then you are no longer under the supervision of the organization. And in those cases, it acts as the first point of contact of recording an entry that you recording the entry and exit of you coming in and meeting somebody and then leaving the organization or the building. So risk assessment gets started at that, at the very basic point when you're even visiting an organization, and that could be, say, an example of a visitor's book or a welcome book that you sign in order to ensure that the organization is made aware of your presence. And till the time you're in the organization, in the premises, in the building, it is the responsibility of the organization to ensure your safety or your health and safety. And if anything is to happen, things like first aid, and other services need to be provided to you because you are within the jurisdiction of that organization. Now, when we look at risk assessment and when we look at care planning, how do we relate risk assessment to health and social care sector? Now, let's take a simple example that assume if you had a loved one or somebody who's very close to you, a near dear one, who's about to undergo some sort of a treatment in the hospital. It is very important for you specifically, and also your your relative, your near dear one who's going to be looking at undergoing an operation or a procedure, for them to be able to understand whether this is the right place for them to undergo the treatment or not. And in those cases, there is a certain amount of planning that would be done. And this planning, if we use the word care planning, would be required to be done to ensure that the treatment, the place, the after treatment, therapy or after treatment support that the patient would receive would be conducive for the patient to go in, and gives that patient the confidence that, okay, if I'm going to go in and I have this problem, when I come out, my problem or my issue resolved, and that gives the patient mentally a lot of confidence and boost, and places a lot of trust in the people who are going to be delivering care. So when we look at risk assessment, creation of a care plan, for example, discussion with the clinical nurse, discussion about the procedure with the doctor or the consultant before you undergo the operation, the leaflets or the additional information which is provided to you. And I'll give you an example here. For example, if somebody's to undergo, say, for example, some sort of an angioplasty, that means you have a blockage in the heart, and you have been referred by your GP to a consultant, you go into the hospital, and obviously you undergo some sort of a consultation first to understand how the process would be, what would be the procedure, what are the benefits of the procedure, what could be the drawbacks of that procedure, what are the risks involved in undergoing an operation of that nature. All this discussion would be a part of your care plan. So when you go to the GP and the GP refers you to an hospital, the NHS puts together this care plan for you as a patient to go through the whole process, understand what will happen, how it will happen, what are the timeframes involved, who are the people who are going to be involved, what is the preparation that you need to do before the operation, what are the let's say bits and pieces in terms of information which are provided to you that would be required to be followed after your operation, so that you can get back to your usual life and day-to-day operations that you do or for activities that you do. They will all be constituting a care plan. Now, during the creation of this care plan, there is a risk assessment will be done. Risk assessment in the case of that patient which is undergoing a heart operation would be things like they would be looking at taking bloods, they would be looking at taking blood tests which will be done to diagnose if the person has or the patient has any underlying conditions like diabetes, any other conditions which could be related to has that person undergone an operation before, has the angioplasty happened before, do they have any allergies, and in terms of what is the blood type. All these bits which are going to be discussed and filled up into some sort of a pre-operative form, which will be the information taken from the patient, would all be then used to primarily do risk assessment on whether the person is fit for this operation. Are there other procedures which can be then discussed with the patient? If the patient is vulnerable because of certain conditions, what could be the risk associated with the surgery? And they will then be explained to the patient and the relatives of the patient. And this would be essentially going hand in hand with what is called risk assessment and the creation of a care plan for the patient who's undergoing this heart operation. Obviously, the National Health Service and the hospital and the people who are involved will need to be looking at compliances. And there will be some information which is normally provided to the patient on the quality of care, how the care is going to be delivered, what are the various compliances. If a stenting needs to be done in the heart to remove a blockage, then what is the recommended let's say stent which will be put in, and has it been approved under the regulation. All these things will fall under compliances. And then funding for the care, obviously in the case of the NHS, the funding is going to be through the National Health Service. The patient would not be required to pay anything or pay for the services, apart from if you're say for example paying for your prescription, things like that. But yes, all this is going to be discussed, and the main component of gathering information from the patient about the patient itself and about the condition of let's say the condition of the patient are all going to be done, noted down into a patient information form. And this is then going to be used to do risk assessment to see whether the patient is okay and can undergo this operative procedure. If that is not possible because of risk to life, then these risks will be explained to the patient and the family, and there would be other procedures, if there are options available, would also be discussed. And all this will be classed as part of what is called risk assessment and care planning. So as you can see, although this particular term risk and risk assessment does apply universally to mostly all sectors, but in the case of health and social care, in the case of when we talk about National Health Service, NHS, risk assessment is going to be contextualized to the risks which the patient faces or can face because of the operative surgery the patient in this case would undergo. And this is also quite important because there are various policies and procedures which are going to be followed. The information which is provided by the consultant, by the GP, by the clinical nurse, or the practice nurse, which is going to be essentially involved in the care plan when you have had the surgery, and the staff in terms of healthcare workers and social care workers, which will be involved in ensuring that you're back on your feet and you're doing your day-to-day activities, will all be following certain policies and procedures, and they will be related to your health and safety to ensure that you're back on your feet as quickly as possible in the circumstances given, and with medication and other things that you are going to take. And hopefully this will bring you back in terms of, you going back to your day-to-day activities. So it is a very important concept. It is something that we need to understand. There is a bit of theory that we will go into. And what we will do is just look at a short video, which is to give you an idea in terms of how risk assessment is essentially done, and from a point of view of the health and social care setting, and that is where this video would come in handy. So let's have a listen in and look into this video for about a couple of minutes. There are two which I'm going to play. One is a generic one, which basically talks about risk assessment in health and social care. And then I'll show you an actual video of a care home in which, how risk assessment is done and why it is important that these risk assessments are done on a regular basis in order to ensure that any risks which are encountered can be mitigated, plans can be put in place to reduce those risks. And because of the reduction of those risks, the risk to injuries and hazards which clients can face or patients can face are reduced. And that is why it is very important as a concept that the implementation of health and safety policies and policies related to making sure patients are safe, people are safe, customer service, they receive the care which is required in a particular setting and can receive it confidently and have that faith and confidence in terms that, yes, I'm going to be receiving care, which is, I'm in good hands and I'm going to be, obviously getting well soon, or, getting rid of the problem that I've come in to get it operated. So let's see this particular video. So as you can see, this particular video basically shows us details of, how risk assessment is done within a particular setup, in health and social care. Now, let's look at another video which basically shows this in implementation. So let me play that and then share the screen.
Care homes should present a safe environment for staff, residents and visitors. But good standards of health and safety do not just happen on their own. Safe systems of work have to be implemented. Staff have to be trained. Machinery and equipment have to be maintained in good working order. In other words, health and safety has to be managed. as with any other part of the business. Paying attention to health and safety is not only a legal requirement, it also makes good economic sense. Losing valuable staff through preventable injuries such as a fall on a slippery floor or back pain caused by poor lifting techniques costs the care industry millions of pounds every year. Risk assessments identify the risks to the health and safety of staff, residents and visitors and examine the best methods of eliminating or reducing those risks. In many cases, measures to control the risks can be obvious and easy to implement. Trivial hazards can usually be ignored, as can hazards with an extremely low likelihood of occurring. Some assessments may be simple and arise directly from observation. For example, if the lift door closes too quickly. Others may be more complex and could include things like staff training needs, type of equipment, how it's used and by whom, or building alterations to meet the needs of residents. The cooperation of all members of staff is important in the process of risk assessment. All staff must constantly be aware of potential hazards, which must be reported and controls implemented to reduce their risk. There are 5 steps to risk assessment. Step 1, identify the hazards. Step 2, identify who is at risk. Step 3, evaluate the risks. Step 4, record your findings. And step 5, review and revise the assessments. Step 1, identify the hazards. The meaning of the term hazard is something with the potential to cause harm. This can include particles, substances, machines, methods of working, the working environment, and other aspects of work. The best way to identify hazards in your care home is to walk around the home and look for them. This may be achieved by either observation or consultation, and the best system will contain elements of both. Observation. Watch people at work and look for situations which could be potentially dangerous. Working practices often differ considerably from official procedures, so discreet observation may be required. Don't forget to take into account all non-routine operations such as maintenance, deliveries, and emergency arrangements. Consultation.
So as you can see in this case as well, obviously this was a video which I've clipped because they are going to be looking at obviously, going through the process of whole process of doing risk assessment, and basically the 4 steps which are involved are going to be discussed. But generally the idea was to try and showcase that when we talk about the process of risk assessment, what is involved, and obviously from our perspective we are looking at seeing this being implemented within a care home to get an idea and to get a perspective that why it is very important. So examples of the lift door not closing, for example, is a case in point wherein sometimes even to when we are providing services and there's disabled access and the access is provided through lift for patient or customers, in those cases these points have to be looked into or taken into consideration, and these will all be involved in the process of what is called risk assessment. Now, with this background in mind, let's go into some of the assessment criteria. And what we're going to do is basically address some of these points by discussing more information which is given in the indicative content in terms of what are risk assessments, what do we need to cover, and how do they relate to things in terms of the legislations that we discussed yesterday. Now, the first one talks about basically, if I do away with the jargon in terms of command verb, it says how information from risk assessment informs care planning for individuals and organizational decision making. So here what we want to be looking at is when risk assessment as a process is carried out and as a is carried out within a setup or an organization, how does it inform relevant individuals, which means care workers, nurses, doctors, GPs, practice managers? How does it give them information about what kind of care or what type of care actually needs to be provided to the individual who's coming to receive that care in the care home or in the hospital. And how does that particular information, which is gathered from risk assessment processes within the organization, help in decision making or making the right decisions, essentially to ensure that the setup or the facilities get to provide these let's say basic amenities which are required to be able to give out care or for the patient to receive care. Now, risk assessments are primarily done because some point in time, what we also need to do is document them to create records that, okay, these comply for the reasons of compliances. So if I may put it this way, that sometimes some of these things have to be done primarily to ensure that we have got documentation and we are meeting compliances which have been set by bodies like CQC, which ensure that quality and standards do not slip within some of these organizations and care or setups as care homes, as we would know, in terms of delivering care to the patient. So a risk assessment is a written record. It gives you what was the time and date on which the risks were assessed, and what kind of risks actually or potential hazards essentially were there at that point in time, and to basically look at mitigating these risks. What were the steps taken or decided that they will be taken by the management in order to do away with those risks? Now, risk assessments is a legal requirement under the Management of Health and Safety at Work Regulation 1999, which we discuss, MHSR, and this is primarily to be done in all organizations delivering care to patients regularly, and in most cases it is done on an annual basis, whether it's for equipment, infrastructure, facilities, even personnel, and to a certain extent things like you have to undergo certain trainings which ensure that you are having the skills and the knowledge to be able to operate the equipment and provide care to the level of the standards which have been designed within the organization. Now, the information which is collected from risk assessment is essentially useful in many locations, but obviously for the context of this particular assessment criteria, we're looking at two important points. One is, how is this information going to be useful for creating a care plan or providing individualized care to a patient within the setup? And the second thing would be, how would this information from the risk assessment which has been done or has been carried out would be useful for the management, or for example, the registered manager in a care home or the practice manager, to be able to make long-term decisions to ensure that these risks are not faced again in the near future, and they do not pose any risk of injury to the patient or staff or workers working within the setup. Now, when you review, and there are lots of different types of risk assessment formats, but depending on the policy, and the, say, for example, the health and safety policy, which is implemented within the organization, you would generally see that these risk assessment plans, risk assessment as a process is normally done using the health and safety executive, template which is provided. And these could be customized, contextualized to the requirements of the organization. And in those cases, when it is contextualized, it is basically meeting the requirements which have been specified in the policy within the organization. So if I just share with you very briefly a template in terms of how risk assessment is done, and this is a particular template which is also going to be available on Moodle, and obviously the idea there is to understand how risk assessment is done. So this is a standard template which is being downloaded from the hsc.gov.uk website, and as you can see, this talks about how risk assessment can be done by somebody who is a qualified health and safety officer within the organization, and they would then go about doing the risk assessment on various different aspects in terms of departments within the organization. So things like company name, date of review, assessment was carried out by which person and on what date it was carried out, what are the hazards which are, have been detected or have been discovered, what kind of harm these hazards could cause, or where, how they could potentially cause a harm or injury to patient, customers, visitors or staff within the organization. What kind of risks can they pose? How these risks can be controlled? And then obviously looking at what kind of actions or corrective action has to be put into place to ensure that these risks do not cause any injury. Who is the action going to be carried by? Or, who's going to be responsible for actually, carrying out this action? And then when this would be completed, by what date? And this tends to be, a simple template, and this obviously, as you fill in, can be expanded to cover all the details, which could be within a care home, within a hospital, within a GP surgery, depending on where it is being carried out. It can be used and obviously then reviewed by the management or the health and safety officer to ensure that, the risks that have been discovered, there is a plan which has been put in place to mitigate or remove those risks. If I show you a working template, just as an example, again, this will be up on Moodle. This is a risk assessment template, essentially, which has been, slightly modified. But as you can see, the main headings do remain the same. There are some guidance notes which are also provided so that you are aware that what kind of risks you're going to be assessing and what kind of checklist that you will go by to do the risk assessment. And that has been clearly given here. And this is a much more suitable template which could be put into action because you're looking at risk assessment from a point of view of employees, staff. You're looking at risk assessment from a point of view of visitors, workers who may be providing the care. And then also you're looking at things in terms of what kind of activities can, which are done within the setup can actually create, if it does create any risks or, poses any hazards, what these hazards and risks could be. And you're basically listing them down and, going through this 5-step process of doing basically risk assessment. Now, when we talk about obviously doing this risk assessment, what we are looking at is that at some stage when the risk assessment is done, the data which comes out of this risk assessment would clearly identify or give you action points to be able to do. So one, it will give you the risks, what kind of activities actually, or what kind of risks are present, whether it's risk from equipment, risk from infrastructure, risk from not following the standards. It could be risks from, say, for example, shortage or scarcity of certain resources within the organization. And then what steps have to be put into place in order to ensure that these risks are minimized. And they will come across from step 4 or 5. And that is where, risk assessment or risk assessment analysis would definitely be helpful. Now, let's look at an example of how risk assessment actually works. So a basic example that I've taken in place is that fire is always a hazard in a workplace. So that is why you normally see designated areas which are created in and around public buildings and obviously offices where people can go and have a bit of smoke. So for example, if people smoke, then there are designated areas which are created wherein they need to be present, and they are normally outside or certain distance away from the main premises in order to avoid any potential risks which could come out of, which could be created because of fire. Now, sometimes you could also have these risks which could be associated with equipment which is either damaged or has not been serviced properly. And in those cases, they can also cause fire or hazard. One of the hazards which could be, can lead to a bit of a cause of risk or injury would be fire, which could originate because of the equipment not working properly or say, for example, in some cases not being serviced and leads to a fault, and it then obviously sparks or short circuits and creates a fire in the premises. Now, in order to look at ensuring that health and safety and policy is implemented and ensure that everybody is safe within an organization, some organizations clearly display a policy which basically says they have a non-smoking policy within the building. So if you need to smoke, you need to go outside. There is no, as per law, there is a restriction in terms of smoking within the building. Sometimes you would see that there are checklists which are, or safety checklists which are installed next to certain equipment which staff can use. So if you look at care homes, nurseries, basically sometimes where you have childminders who are primarily involved in the laundrette, and obviously in terms of, operating washing machines, tumble dryers, and they generally take care of the laundry in a nursery, in a children's nursery, you would see that there are certain checklists which are installed to ensure that workers are aware that you should not have wet hands, or water should not be dispensed here, or in some cases, there should be proper ventilation in order to ensure that there is the appliances don't heat up. And these are basic checklists. So if the equipment is not being used, you need to switch it off. If in the event the equipment is not working or stops working, please call a qualified electrician or notify the authorities or the relevant manager on that, duty manager on that day. And these are basically checklists which are installed or displayed in order to ensure that proper policies and procedures are followed. So workers are given instructions in terms of understanding if these things do not work, this is the next step of the process that you need to do. You need to call the duty manager, and they would then be looking into this particular fault. And this bit in terms of the process, what happens next, what happens next, what happens next, is primarily the process through which you go and you look at, then creating policies which will basically be acting as guidance for workers, staff, people working within the organization to understand that if this does not work as planned, this is what needs to be done. If this does not work, then I need to contact this person. And it gives them a kind of a book to go by to understand what things have to be, how things have to be, how things would work, and obviously who they need to sensitize or call in the case of an emergency or if such a situation would arise. And this process that we follow tends to be a 4-step process, and this process is to understand it theoretically. What we need to be able to do is understand the 3 distinctive stages, which basically we need to go through in order to identify the risks. So risks tend to be essentially, areas which can pose or cause a problem in the future, and this could be because of equipment, infrastructure, resources, less scarce resources, or lapses, or human error, and they have to be identified during the risk assessment plan. Now, in order to deal with risk, what we need to look at is go through this process to understand, how do we work, how do we look at this process of risk assessment, and what is the outcome of that. So first of all, we need to understand the person's circumstances. We need to be able to then identify the risks which the person is facing. We need to assess those risks and the impact of those risks, the likelihood of the impact of those risks on the patient receiving the care, and then finally look at how do we manage this risk. And when I say manage this risk, this is where the organizational decision making comes into play, because when the risk assessment template is looked at and all the information is gathered, it will straight away give you what are the risks, who can be harmed from these risks. It will also tell you what is to be done or what we are already doing to mitigate these risks. If there are further actions which are necessary, then the consultant or the competent person would basically identify what actions could be necessarily taken to reduce further these risks, and who will put these actions into place and by what date. And this would be the organizational decision making that needs to be done in order to essentially, analyze and assess the risk associated when a care is being provided, or care planning essentially is being done to be provided to the patients or any particular customer client who's going to be receiving care in a particular setup. So I hope this first particular assessment criteria is clear, wherein we need to understand what is risk assessment, why is it important as per legislation, what are the various ways through which risk assessment can be done, so we can make use of a template. And then once the risk assessment is done and we have captured the information, how this can be used by the organization to look at, by the management in the organization to look at decision making from a long-term perspective, short to long-term perspective, and from a point of view of health and social care worker, when we are looking at putting together a care plan, for a patient, and this would then come in quite handy. Now, in the second assessment criteria, we are basically looking at understanding the impact of, health and safety policy within a particular setup. So here, if we assume that we have created a care plan and we now are looking at implementing that care plan for a patient within the setup, and the patient has got admitted. So if you imagine a situation where essentially what will happen is that I gave an example earlier that a person or a patient is going to be undergoing heart surgery. After the initial consultation and everything, the patient has decided to go ahead. They have spoken about in detail the procedure, the process, the post-operative surgery process, how the recovery phase will be led, and everything has been discussed with the doctor, the consultant, and the nurse, and the patient has said, yes, that I want to undergo the surgery. And in this case, now what will happen is we need to look at how the patient would undergo this particular surgery and what are the policies which would be implemented in order to ensure that the patient receives the due care and is able to then come back out of it successfully and, beat, say, for example, the reasons why they had gone into this care in the first instance. So when we talk about the impact of health and safety policy, what we are looking at here would be, the main regulation of health and safety work regulation, MHSR of 1999, which we discussed, which requires obviously all employers, all staff employees working within a setup to carry out risk assessments and to ensure that they are able to eliminate or minimize risks to health and safety of the patient. So when we talk about, the use of, say, personal and protective equipment, PPE, this particular bit is used, to primarily minimize the risk to health and safety for the individuals who are actually providing the care. So if I give you an example of why PPE became very important during the COVID pandemic is because of the fact that a lot of people who were, when I say a lot of people, I mean a lot of healthcare workers, social workers, physicians, nurses, people who were involved in primarily providing care during the COVID-19 pandemic in hospitals to patients in the ICU also ended up contracting COVID, and there were a lot of fatalities in terms of loss of life. And PPE, was later then made available in abundant quantities to ensure that anybody who is providing care to a COVID affected patient, then in those cases, the personal protective equipment made the difference in terms of ensuring that the health and safety of the worker providing care, whether it's the janitor, whether it's the nurse, health and social care worker, anybody who is basically providing care to the patient during their recovery phase was not infected and was kept safe because of the use of personal and protective equipment or PPE. Now, when we talk about some of these aspects in terms of how health and safety policy impacts, the working or day-to-day working of staff within the organization, we need to be able to look at, understanding why this is important. And from a legislation point of view, what are the various legislations which come into play, which basically ensure that employers are ensuring that the implementation of the health and safety policy is done in a way wherein it protects staff, employees, workers, and also its customers, when I say patients, essentially, who are receiving care. Now, if we look at some of the policies which will be directly related to this assessment criteria, we're going to be looking at the health and safety work regulation. We're going to be looking at, reporting of injuries, diseases and dangerous occurrences regulation, RIDOR as we call it. And we are also going to be looking at the control of substances hazardous to, health regulation, or COSH, which are basically going to be directly related to this assessment criteria, because here these would be used and have to be implemented, followed by any, setup within the National Health Service or a care, provider to minimize the risk to health and safety from the use of either any hazardous substances, nanomaterial, or in terms of ensuring that all the equipment infrastructure is safe for the workers to be able to work and deliver this quality of care as per the guidelines set by CQC to patients who are coming in to receive care within the care home or the hospital. Now, in order to look at this particular assessment criteria, let's look at a bit of a case. Now, this is an actual case which I have put forward, and this actual case basically looks at two things. So I've anonymized the name. So what the case talks about is that if you're a care worker and a care assistant who's basically going to meet one of your clients or one of your patients who's receiving care at home, and that person I've called K. So if I look at the K, who is the care assistant who basically goes to the client, which is Mr. W, and when she reaches obviously the house, she finds that the house is in very poor condition. Mr. W has a pet, and obviously she has read into the file of the patient, and she knows that the patient has a history of psychiatric illness, and in the past has been admitted to the hospital under the Mental Act of 1983. Now, when Kay arrives into the house, she finds that the house is in very poor condition. The garden is overgrown. There is a lot of rubbish and old furniture in the house. The front door of the house is open, and she also sees that some of the floorboards in the house are missing. And obviously, there is a possibility that if somebody is to walk through the floor, the person could drop into the cellar, and this poses health and safety hazard, not just for the client, which is Mr. W, but also for the pet. And if anybody is visiting, she is visiting as a care assistant to see the person, also will face health and safety hazards. Now, what she needs to do in this case. So looking at the three regulations, which is primarily looking at, say, the work and health, so work safety and welfare regulation of 1999. Here, what she has to do is basically alert the relevant authorities in terms of the conditions, quality conditions which are there in the house. The house maybe, or the accommodation not being fit for purpose, and which could pose a threat or danger, essentially, in this case, and to the health and safety of the individual, because the individual could slip, trip, or fall, and that could lead to further injuries to the patient, which is Mr. W. Now, the second bit that she has to look at is she has to look at ensuring that there is no risk of injuries from diseases and dangerous occurrences. So she has to also inform relevant authorities that the patient has a dog, and that they would come in and weigh up the possibilities of any infection which could happen through the pet, and in this case, what are the risks involved for Mr. K. So this would be the second regulation that we will need to look at from a health and safety policy perspective, that she would need to follow and sensitize relevant people to ensure that the client or the patient in this case is kept safe. And the last would be to look at hazardous substances, which could be a threat to the patient, essentially, itself. And these could be because of the nature when she comes in and discovers that there is rubbish and old furniture, and obviously the property is in a bad condition. That this could create deteriorating circumstances wherein, for example, damp or other things could be considered under what are called dangerous substances, which could also pose a risk to the health of the client, which is Mr. W. So when these risks are identified, she would then need to look at implementing, or first of all, notifying relevant authorities, maybe a manager and relevant people within the setup of domiciliary care, which are providing the care to the patient at their house, to ensure that they are able to come in and do relevant checks and ensure that there is proper implementation in terms of obviously the health and safety standards. There is no risk which is posed from say, for example, from the property in terms of causing any injury. And the third would be to look at any hazardous or substances which could basically pose risk or cause further inspection either through the pet or the property itself, because it's in a dilapidated state or in a squalid condition, and that could affect the health of the patient. So in this case, as you can see, if she's able to pick these 3 points up and see the implementation of these 3 policies, this would have a positive impact on how domiciliary care can be provided to Mr. W, which is the client. And in this case, it identifies the risks with the assessment she has done, and by informing relevant authorities or people within our organization, which are able to then come and do the further assessment of the risk, and then and mitigate. When I say they are able to negate or mitigate these risks, which can pose risks in terms of health and also in terms of safety to the patient who's receiving this care at home. And this is how you would generally be looking at implementation of some of the health and safety policies and the standards and the acts and the legislation which have been put in place to ensure that the nature of the care and the kind of care is provided, which is provided, is meeting the quality standards as set by CQC. So I hope this particular assessment criteria is clear. We have to look at picking out some relevant policies from the ones that we've discussed in Learning Outcome 1, take an actual example to do some analysis and talk about how this is then put into practice and what policies and regulations are followed in order to ensure that risks are minimized and risks to health and safety of the individual is minimized who's receiving the care. Let's quickly go across to the assessment criteria 2.3. Here we are looking at discussing dilemmas which could be encountered in relation to implementing systems and policies. So again, here what I would do is basically talk about through one or two examples to discuss what could be the dilemmas social care workers actually face or people within the sector actually face when they are providing care to the patient. So when you look at health and safety policies, within an organization, they would sometimes pose, issues or create issues or, doubts, essentially, if I use another word or a synonym for dilemmas, when the care is being provided. Now, there are different kind of dilemmas which can come in, and obviously some of these could be related to resources. It could be risk related to the individual and others in some cases. It could be different priorities which are set by the stakeholders in terms of your manager, the care worker himself, the patient himself, and sometimes changes in legislation can also mean that these, they could pose different doubts or create doubts or issues and dilemmas essentially when the service is being, provided. And sometimes you would also look at certain acts and legislations like Human Rights Act, and you look at the person-centered approach, safety regulations, which could also be posing dilemmas when they have to be implemented to the core to ensure there are no risks for the patient or the staff or the workers providing the care. Now, if I look at talking about this particular criteria using an example, one such example could be that I have put out is that, say, for example, we are dealing with a patient who has lost the mental capacity to make decisions. And in this case, this would be deprivation of liberty safeguards. So when we look at this particular option, this would mean that under the law, somebody who has become incapacitated to be able to make decisions, then under this law, deprivation of liberty safeguards, wherever it is necessary, we can deprive the client or the resident or the patient who lacks the capability to consent for their own care and treatment in order to ensure that they are safe from harm. So they cannot do self-harm and they are also safe from harm. So in those cases, we will put this into place, and when this has to be put into use and into practice, you would see there will be a dilemma which comes in wherein how do we look at assessing the patient is mentally incapacitated, does not have the capability to be able to make decisions. And when this legislation has to be put into practice, there is a dilemma which could arise in the minds of the social care workers or in the minds of the relatives that this would mean that they would be faced with a decision that they are not willing to take, and in such cases this would be a dilemma. Now, sometimes you would see that this particular legislation can be overridden by the Human Rights Act of 1998. So, for example, if the person tries to explain and go through the explanation of the state, situation with the patient or the relatives of the patient, and they override, they say, yes, we are in agreement, we are in sync, then this deprivation of liberty safeguards can be overridden by Human Rights Act. And in this case, this can pose a risk or maybe create a dilemma for how the treatment has to be given to the patient. So when you look at high risk situations, sometimes, this has to be taken into account, and obviously in the, for the benefit of the patient, what has to happen is that the decision has to be taken And in those cases, what you will look at is that sometimes healthcare workers, social workers, or people involved in providing care, clinicians and nurses and doctors have to make these tough decisions in terms of ensuring that the patient is pulled out of the harm's way or is not able to self-harm, and in some cases receive treatment which is required for the patient to get better. Let's look at another instance. So, for example, if you have, let's say, if you are a social care worker and you visit the home and you normally go and obviously provide certain care, domiciliary care to the patient at home, and one fine day you go and visit your patient and you find the patient is not there. The patient is not there in the house, and you start making some inquiries. You basically call a few people or check with the neighbors or maybe the relatives, and you're still not able to find the whereabouts of the person. So in those cases, one of the dilemmas that you would face is, should you report and call your manager? Should you call the police to report that the person has gone missing and provide all the information? Now, these are dilemmas that social care workers could face when they're trying to implement system and policies in the process of adhering to delivering care to patients. Now, when we look at obviously certain acts and legislation, so when we look at the CARE Act, what we do see that there is a legal safeguard, which is the obligation, in this act, that we have to, safeguard the patients by making sure that they are in a safe building, they are in a safe location, and the situation that they're in does not cause them any harm or danger to life. Now, if anything is to happen, which is something which is not within your control, then you have to inform relevant authorities. When I say relevant authorities, well, relevant people who manage health and safety and standards for that, to be able to ensure that they are able to come in and take action in time so that a life could be saved, or certain risks which the patient can face because of the actions being taken are mitigated, and that would mean saving a life. So some of these are examples of dilemmas that health and social workers might face when they're trying to implement system and policies as described or as given in their employment contract or by the organization. And these could be, creating sometimes doubts, issues, and pose dilemmas primarily for the purposes of implementation. Now, a quick other example that I would put forward just to, bring home this point is, when you're looking at one of the acts, Data Protection Act, of 2018 now, when you look at the Data Protection Act, sometimes what happens is, if you are a care worker or if you are somebody who's involved directly with the patient in terms of delivering that care, and you are privy to certain information, and this information has to be then shared or is being sought by members of the family or relatives of the patient, how much information can be shared, whether this is the right time to share that information, whether you can disclose all the information, and with keeping in line with the Data Protection Act and obviously privacy part of it, which the patient is, let's say, when we look at the person-centered approach, privacy, and information is something that can only be disclosed under certain circumstances. Again, when we look at following the policy and procedure, this would mean that you can disclose this information to the family or family member. But in some cases, this would be detrimental to the patient because they would not be comfortable in that information being shared with with other members of the staff or, for example, their family. And this would then pose a dilemma essentially to the health and social care worker in terms of what is to be done. So there are scenarios in which sometimes you would see these situations arise, but obviously when policies and procedures are implemented, they can sometimes pose dilemmas to people who are actually giving out this care or are responsible for delivery of this care to the patients. Now, the last assessment criteria in this particular learning outcome talks about the effect of non-compliance. So essentially, when we talk about the effect of non-compliance, that means if policies and procedures are not followed, laws and legislations which have been laid down to be followed within the health and social care sector, things like the CARE Act, the Health and Safety Act, we talk about the NHS Act. There are lots of these legislations that we discussed yesterday, which are the Mental Health Act, the Care Standards Act, the Children Act, the Disability and Inequality Act. And if these standards are not followed, then it creates non-compliance. And non-compliance with these acts can pose serious threats under health and safety in terms of services being delivered within a particular health and social care setup. Now, these non-compliances obviously can pose risks and also lead to termination of services, can also lead to cancellation of licenses for care homes or any such organization or setup which is delivering care. And in some cases, it can also lead to criminal offenses and criminal offenses being booked against the member. When I say member, I mean the staff and personnel which are provided, are responsible for providing this care within the care setup. Now, when we look at these compliances, non-compliances, essentially, you would generally see that the inspection organizations like CQC, NIHR, NIC, they would primarily be issuing non-compliance related documentation first. So, for example, some of these workplaces will undergo routine inspections, and if there is a non-compliance which has been discovered or detected that this policy or this is a lapse which is happening in the implementation of this particular policy within the organization, generally the organizations and the individuals responsible for carrying out those duties are given enough notice or warnings, as I would say, if they are leading to non-compliance with regards to the following up and implementation of that policy or procedure within the organization. Now, if these are leading to serious consequences or can lead to serious consequences like injury, loss of life, or life-threatening injuries, then in those cases, even sometimes licenses, after giving warning and giving a particular amount of time to be able to course correct that particular, say, for example, the problem. If after that they have not been complied with, then the termination of licenses or services can be done by the CQC or the standard bodies to ensure that lives are not put at risk and the quality of care does not slip for the patient which are receiving this care. Now, in severe circumstances, if there is continued violation of this in terms of non-compliance and laws and legislation are not followed, then it can also lead to serious consequences in terms of imprisonment, fines, and financial fines, and leading to the cancellation of, license or even imprisonment under certain acts and legislations within the care sector. Now, one of the other quick things which I would want to point out is that sometimes there is room, and when I put it this way, let me rephrase that. There are, let's say, procedures in place within organization wherein people can report if the non-compliance is going unnoticed, if the manager or the management is not willing to rectify the non-compliance, or if they are not willing to cooperate with the staff in order to ensure that these slippages in quality of care or lack of resources are not dealt with. And sometimes in the organizations, you will see what is also present is what is called a whistleblowing policy. Now, whistleblowing policy tends to be when you essentially, stay and you're a part and parcel of the organization. You basically then, act as a whistleblower. That means you, in the goodwill, under this particular Employment Right Act 1996 and Public Interest Disclosure Act of 1998, you are basically, you are, let's say, a worker within an organization, and you have the right as a worker to take this case up, because what you are seeing is that you are seeing continuous slippages of policies not being followed or standards being breached. And in this case, you feel that this would put risk, this would pose a serious risk to the patients receiving care or people receiving care within the particular setup. And what you decide to do is, rather than stay quiet and observe, what you do is you basically report it to relevant authorities so that, course correction can be done, or, inspections can be done to ensure that the requirements are met. And in this case, what you would generally see that the person would follow some sort of a process wherein the person would identify the issue, why is it occurring, and then document those issues with some facts, and then basically provide it to relevant authorities as a whistleblower to say that, okay, these are things which I've noticed, I've discussed it with my manager, but obviously there is no action being taken by the management. And this is where I've decided now to go public, or basically make this aware to relevant authorities, because this is posing a serious risk under health and safety for people delivering the care, and second, for patients who are receiving the care within a health and social care setup. So you can make a call, you can submit a disclosure, and you can do so confidentially. This is where your identity is protected, so that the employer can not go after you. And this is sometimes covered under what is called the whistleblowing policy within an organization. So there are different ways through which non-compliance can affect the working of a setup or a care home, or a health and social care setup. And obviously non-compliance can lead to non-compliance of these policies can effectively lead to cancellation of licenses, imprisonment, and in some cases, warnings. It starts off with warning in order for the organization to course correct that particular shortcoming. If warnings are not issued, then services could be limited, funding could be withdrawn in this sector, and in some cases, cancellation of licenses can also happen. And if there are serious breaches, fines can be imposed first, and then cancellation of licenses, and finally can lead to imprisonment as well. So these are some of the impacts of non-compliance of health and safety regulation within the health and social care sector. If the policies are not met, care services cannot be provided to the standards. And if these are not provided, they are basically posing a risk, a serious risk, or a risk in terms of harm, can lead to harm, or various types of illnesses, and even, let's say, pose life-threatening, life-changing threats to the patient who are receiving service or care within the setup. And this can have legal ramifications in terms of warnings first. If warnings do not heed, then obviously suspension of services, suspension of funding. It could lead to cancellation of license, and even criminal charges and imprisonment against the management if they fail to act and to ensure that non-compliances, or compliances with the health and safety regulation are not done and implemented within the setup. So any questions at this stage, happy to take. And, a copy of this recording and the presentation with some handouts, including the risk assessment template and one or two articles for additional reading would be available on Moodle. And that would be giving you more insight into what we've discussed today with regards to understanding the ways in which health and safety requirements impact on customers and on work practitioners, specifically within the health and social care setup.
Okay.
Good stuff. So any questions at your end, Elias, on this?
I'm okay for now. But I think all I do is I do the recap, and I'm doing the assignment also gradual. So I will send you what I need and what help I need. But at the moment, I think, have I told you that I've lost my brother again?
No, that was
that was last week.
All right. Okay. So I know that you lost your mother or grandmother.
No, I lost my father.
Sorry.
And my brother, and my junior brother. So I got 3 people at the stake now.
Oh my goodness.
3 people at the stake now. So
you're going through a very tough time. I'm
really, really in pieces.
And what is the reason why these sudden,
the younger one, the migration, he was a migration. He was having a kidney problem.
All right.
So he was going actually dialysis.
All right. Okay.
So that one is really acceptable. But the senior one who died last week on the 5th of July, he was minorly sick.
Okay.
And he picked the shock from the death of my junior brother.
Oh my God.
And got a heart attack and then died.
That's awful, really awful. To be honest, I don't have words what I can say, but obviously.
No. It's true. I'm in pieces. I can't lie to you. I am really in pieces. And according to our tradition, my father died January. So in plan, we should be buried him on the 5th of August. So that is still in plan. So I'm going to bury my father on 5th of August. But my junior brother and my senior brother too, they have to be buried on the 26th and 27th of August.
God.
So within the August, I have to bury three of them.
God, this is like too much on your shoulders, to be honest.
Too much. I said I am in pieces.
I totally agree, and I can relate to that. So if you need any additional support, or you need anything from us, do let us know.
Okay.
Obviously, we can organize specific sessions, or maybe even look at doing one-on-one sessions separately. But yeah, do let us know if you need any help from us.
Okay. All right.
And
Thank
if
you
we
very
could help
much.
in any way.
All right. Thanks very much for that.
No worries, Elias. Take
All
care.
right. Okay. I'll let you go now.
Thank you.
Bye.